We are going to start with the COVID-19 situation in South Korea, which is worsening by the day. Omicron spreading like wildfire across the nation. Officials forecasting yet another record number of daily infections on this Friday, this time in the six-figure range for the very first time in South Korea.
For more, our reporter Shin Ye-eun is here in the studio with us. Good morning, Yeun.
Good morning.
So we're expecting six figures today in terms of infections.
That's right. We're expecting to see the daily caseload possibly go as high as 110,000 because up to 9 p.m. Thursday, more than 100,870 people were infected with the virus. Just 3 weeks after we saw figures hit the 10,000 range, numbers have increased tenfold. The number of critically ill patients has also hovered in the 300 range for 3 consecutive days. On Thursday, we saw this figure go up by 76. The number has the potential to keep rising from this week, though, but the silver lining is that authorities say currently they have the medical capacity to handle up to 2,000 critically ill patients. A little over 28% of ICU beds are occupied right now. Also, authorities were confident that the at-home treatment system is going well, but some have shared their complaints that things aren't going as smoothly as authorities make it seem, especially with the sudden surge of at-home patients. As of Thursday, over 310,000 people were being treated at or in isolation at home, which equates to 9 out of 10 people who recently contracted the virus. Some of those said they couldn't reach their designated health officials over the phone because the line was always busy, and to make sure there's enough medical staff to help people who require treatment, the government has asked more local hospitals and clinics to provide at-home treatment monitoring and phone counseling.
So given the current situation, what are officials saying about these plans they had, at least, to start easing the social distancing guidelines?
Well, first off, the government has said it will introduce new changes to social distancing guidelines to minimize the damage to the economy and society as a whole. We'll get to hear what these new measures are in the coming hours. Over the past week, health authorities reviewed raising the cap on private gatherings to 8 people from the current 6 and allowing restaurants and cafes to stay open an hour longer until 10 p.m. But this may not happen following discussions at the 8th Special COVID-19 Transition Committee meeting on Thursday. Now, this committee is made up of small business owners, health officials, and economic experts. And during the meeting on a day when Korea saw yet another record high number of new infections, committee members had different opinions on the right time to ease measures. While economic experts and business owners said social distancing measures should be eased immediately, officials working on the medical front said now is not the right time. Those against easing measures said if measures were to be eased, the number of new COVID-19 infections would most likely spike, creating a situation authorities aren't prepared for, which is actually a popular opinion among many health experts.
We'd be risking too much if we ease measures right now. Measures need to be eased after we confirm the surge has come down and we're certain that our medical capacity can handle the situation.
After the meeting, health authorities are reportedly reviewing a new direction, extending business operation hours to 10 p.m. as they said they would, but keeping social gathering caps to 6 people, and they'll release their final decision this morning.
Now, moving on to the vaccination front, I hear that some people will be able to reserve for their Novavax shots beginning next week.
That's right. People aged 18 and up who haven't been vaccinated can make their Novavax shot reservations on Monday. And Novavax is the first protein subunit vaccine to be manufactured in the country. This means that it uses a more traditional method like those used to develop vaccines for hepatitis B and cervical cancer. So watchers say there are fewer concerns about side effects, which is particularly good news for those who haven't gotten their shots or had to stop in between due to side effects. Novavax vaccines can be used as boosters and mix and match shots. Inoculations will start from March 7th. And once people reserve the date to get their first shot, the date for when they can get their second jab will automatically be reserved to 3 weeks later.
All right, Ian, thank you for the report. Have a great weekend.
Thank you so much.